Hello, I'm Dr. Sidney Harris. I'm a hospitalist here at Sovah Danville. I've been practicing medicine in Danville since 1999. I came here initially to Danville in the late 80s, working for the newspaper here as a sports writer, which I loved, but I had grown up around medicine. My father was a physician. He practiced with my uncle, so I decided I wanted to do more with my career. The stay here in Danville, however, was very monumental in my life, and that I met my wife, who was also a writer at the paper. I went on to medical school, and then we came back here in 1999. My wife has been very supportive of my career in every way, and we have 3 beautiful children. My career here in Danville has been a variety of different things. Initially, I was outpatient and inpatient, and then for a period of time, I did outpatient only, and then about 2.5 years ago, I switched to doing hospital medicine only. Regarding the hospital and COVID, I'm happy to say as of today, February the 3rd, we are experiencing a decrease in the number of patients being treated for COVID at this hospital, Sovah Danville. We have 32 between the routine medical ward and the ICU. I'm told that the Martinsville campus has 19, so as a system, we have roughly 50 people, and this represents a downward trend compared to the last update. To illustrate the point that things are improved in terms of the recent surge, a couple of weeks ago, we had to stop doing surgeries here at the Danville campus for those who were going to require inpatient surgery after the surgical procedure. So those types of surgeries were put on hold for the future, and I'm happy to report now that we're able to do those types of surgeries again. This decision did not affect our Martinsville campus. They never had a pause in doing those types of surgeries. So we are back up and running full strength again as it relates to surgeries, inpatient, outpatient, and elective procedures. Our visitation policy has not changed. Patients cannot have visitation. Now, of course, there are special circumstances that we always make exceptions, and we're sort of always, determining whether each individual case, whether that's necessary. And I must say this is a very difficult decision, and I understand that from the provider standpoint. It's challenging because you need that family input. They know the patient much better than we do. It's very hard for the patients. They feel very isolated, and it's hard for the family because they want to be there. And it makes, in this day and age with COVID, it makes communication by phone and any way possible, even more important. And I know it's tough, but it has to be this kind of policy at the present time given COVID, but certainly do not hesitate if your family member is in the hospital to reach out to the provider and request a call and an update, because communication is so important. And I'm happy to say that we have given over 8,000 vaccines between the Danville and Martinsville communities. So that's an excellent start to this vaccine process. The way this is working, the local health department is sort of like the quarterback. They are setting up point of dispensing clinics, also called PODs. They do this in conjunction with our hospital here in Danville and the hospital in Martinsville and various sites in the community that are agreeable to doing this. Currently, the hospital has exhausted all of its supply of vaccine. We anticipate the state will send us more vaccine soon so that we can distribute that to these POD clinics. And so if you want to learn more about that, contact your health department. You can be put on a list. I must say and urge people to be patient. The lists are lengthy because people want to do this. Just be patient. With time, your name will be called and you will get your vaccine. It is so important to get the vaccine. I look at this as an opportunity to do something about the COVID-19 issue. Of course, vaccines are a personal choice, but I really do want to urge those in the community to get this vaccine and view it as an opportunity. A little bit about the shot in general. From a personal standpoint, I've received it. It was 2 doses. The first dose, I got nothing more than a sore arm. The second dose was different. I actually, for a period of 12 to 18 hours, felt rather ill. I had, fever, low grade. I was tired. I had aches. I just didn't feel well. And then it was like a storm, and then it went away. And in a way, I'm glad that happened, because it enabled me to know what people with COVID-19 feel like when they get COVID-19. And so I could handle 12 to 18 hours of feeling that way. These people have 2 weeks or more. And so I would encourage everyone to set a goal to get the vaccine. In closing, I'd just like to make a few additional points about COVID. Please be vigilant in the prevention of COVID. By that I mean wearing masks in public, social distancing, washing your hands. There's a lot of discussion about masks and do they make a difference. I feel like, we're taught in medicine do no harm, so treatments that do no harm are safe. I think that the wearing of masks perfectly illustrates that point. I think it's something collectively we can all do together that creates positive energy, and with positive energy, good things happen. So please wear masks and socially distance and wash hands and things of that nature. I also would like to say, do not delay care if you feel you're very sick with COVID, or if you have COVID and you feel that you are getting sicker. Many cases of COVID can be treated at home, and not everybody with COVID needs to be in the hospital. The keys are, if you feel you have it, or if you have it and you're getting sicker, again, pay attention to how you're feeling. Are you so weak and tired you can barely move? Are you having so much shortness of breath you're just laying still? Those are the people that need to go back and reassess and have your oxygen checked, because that's the main issue, is what is this acute illness doing to your levels of oxygenation. I would like to say this hospital, I am proud to work here. It is a very excellent facility, taking good care of people with COVID. The colleagues I work with are excellent. The specialists in this hospital are excellent. The nurses are top-notch. Nursing assistants, all of the non-clinical people. There's a real, the administration supports us well. There's a real sense of purpose that you can feel in the hospital in the last several months because of COVID, and people have a real sense of purpose, wanting to help people with a very significant issue. So I feel the routine care for COVID patients on the floor is excellent. I think the care those in the ICU get is cutting edge. So please know that the hospital here in Danville, and I'm sure the hospital in Martinsville, it's the same way. Do not hesitate to come if you need attention, and if you're admitted, your care will be excellent.